You got me? Yeah, I'm on lobby 4. Okay. Good. Mm-hmm.
Good morning. When I announced Monday that 2 branches of the St. Louis County Library would be offering saliva PCR tests for pickup made available by the Department of Health, I knew that there would be interest. But I did not mean to overwhelm the library with calls to reserve a test. However, that's what happened. Within the first hour the tests were made available for pickup, the library fielded over 1,800 calls. With a limited number of tests each day, that meant a lot of people were unable to pick up a test kit on Monday. However, on that same day, appointments at the Department of Health's 4 drive-through testing sites were available. So I want to start today by encouraging those looking for a test to start at revivestl.com. There you can find appointments at one of the 4 drive-through facilities as soon as today. And if you don't have internet access, please call 314-615-2660. The drive-through locations are at the 3 Department of Public Health clinics in Berkeley, Pine Lawn, and Sunset Hills, in addition to a temporary site we set up earlier this month at the North County Recreation Complex. With appointment in hand, pull into the testing line at the location you selected, and a health department employee will meet you at your vehicle and take a sample right there. No need to get out in the cold. We're trying to make tests as accessible as possible with the existing resources of the health department. And that's why we partnered with the library, which continues to take reservations for PCR saliva test kits that you can pick up curbside at the Rock Road and Weber Road branches. But again, you must call first to reserve a kit. The library number is 314-994-3300. When you get your test kit at the library, remember that you must return it to one of the health department clinics. The addresses are listed on the information sheet you will receive along with your test. The library cannot accept the samples. The Department of Public Health accounts for about 10% of all testing in St. Louis County, and we are at testing capacity without additional resources. Hospitals, doctors' offices, urgent cares, and pharmacies are among others that offer tests, and home test kits can be ordered from the federal government at covidtests.gov. Testing helps identify new cases quickly and provides critical information so action can be taken to stop the transmission of disease. With the high rates of community transmission in St. Louis County, you should get tested if you have any symptoms at all, or if you were a close contact of someone with COVID. COVID continues to spread quickly through the community. We are averaging about 1,300 new cases a day in St. Louis County, with a positivity rate just under 32%. Masks work. That's why the health department asked for, and the council approved, this critical public health order to keep their families safe. Masks, along with steady increasing in our vaccination rate, will go a long way in getting this virus under control. Thanks for all you're doing, and I'd be glad to answer any questions.
With the numbers dropping with the cases, not only hospitalizations joining that number as well, what would you say to residents just to continue staying on the same trend that we're on right now?
So the question is, with the numbers dropping, do we have a different message for the residents? The message is the same. The numbers are dropping from world record highs, from transmission rates and case rates that we never imagined. They're still way too high. Our hospitals are still overwhelmed. overwhelmed by the number of cases that are much higher than at the highest point last year. And what's different this time is our hospitals don't have the same number of employees because their employees are out sick with COVID, and some of them have burned out and have left work altogether. So the message is the same. We're trending in the right direction. We're on the right road. We are not at the end of our journey, and we need to stay the course, continue with our public health recommendations and restrictions, get vaccinated, and we'll get through this together.
What's your thought about the federal medical team arriving today up at Christian Hospital? We've heard you and other people repeatedly talking about the hospital being burned out and they need help. How valuable is that team, do you think, in trying to cope with the patients still there?
So the question is about the federal team from the Navy that's arriving today to Christian Hospital. Christian needs help. All of our health systems need help. We wish we had more help, and we wish we had more help, and we wish every hospital could get the help that they need right now. Every hospital is struggling. The pandemic task force and the health systems recommended that team go. We had one team coming to Missouri. They recommended that team go to Christian Hospital. I spoke to Dr. Garza about that yesterday, and I agree with their decision. St. Louis County has focused our resources on the most vulnerable communities, especially North County and our African American communities, and I think that was the right decision. That's how St. Louis County has allocated our resources, and I'm glad to see the pandemic task force is prioritizing Christian Hospital.
Is that a Navy team, or what do we know about the team?
Well, we know it's a FEMA team. It's a federal emergency response team, and they are Navy doctors, nurses, and healthcare providers.
How important do you think that can be, Dr. Page, to try and help that facility? Do you think that's critical going forward?
The Navy team would not be arriving to St. Louis County if we weren't in trouble, if we didn't need help. We still have a long ways to go, and being better than the worst we could possibly imagine in case rates and positivity isn't out of the woods. We still have a ways to go. We should be warmed and optimistic that we're headed in the right direction, but we're not there yet. And this Navy team is help that we need, and we're glad to get it.
I know you're tired of me asking this question, so I'm going to ask it again. You know, because it's Wednesday and we've got enough day. Just your thoughts on the new police chief for St. Louis.
Question about the new police chief. I've had the opportunity to work with Chief Gregory over the past 6 months while he's been interim chief. I think he's done a good job in guiding the department, and I think he'll be a good chief.
Is there any thought to adding any kind of more incentives, like the gift card program for vaccinations to try to boost that rate? I think the city of St. Louis had done something a few weeks ago.
You know, the question is about more incentives for vaccines. A gift card program has been piloted across the country. We've tried it here in St. Louis. We've had some modest success with it. I'm glad we did it. I don't know that it will be expanded. We'll talk to our health department and get a recommendation from them, and we'll follow their guidance. They'll tell us what works in helping to get people vaccinated, and we'll implement their recommendations. The health department's been working very diligently and assertively with community partners, with nonprofits, with third-party validators to try and break down the vaccine hesitancy in our community. I think they've done a good job. It's a tough problem here in St. Louis. It's a tough problem in our country. St. Louis County has the highest vaccination rate of any county in Missouri, in a large part due to the success of our public health department.
Dr. Page, are you satisfied with the selection process regarding the police chief? Was there anything there that made you uncomfortable, or are you satisfied where we're at and where we're going?
Question about the selection process of the police chief. I think the Board of Police Commissioners has done a good job. The selection of the police chief is their choice by the charter, and I think they're taking us in the right direction.
Did you have any input at all in the selection process?
I don't get to choose the police chief. The Board of Police Commissioners does. I set the policy goals for them. I tell them what's important from a policy standpoint as far as addressing public safety in our community. They're my appointees. They hear what I have to say, and then they make the best decision based on their experience and their management of the department. I do talk to the police commissioners, but the choice of the police chief or the management of the police department is their jurisdiction.
Dr. Reyes, you said that you thought it was a good selection, he'd be a good chief. Can you expand on that a little bit about what you think is good about Chief Gregory?
Well, the chief is engaging. He has a long track record of engaging the community and listening to the community. He has demonstrated that since he's been acting chief. He's been a leader of every facet of the police department over the past 30 years. He has a lot of support among police officers, among black police officers, among the police union, among the command staff. He's been around a long time. He's earned the respect of people in the department and people in the community, and all those things are very important. I'm really impressed over the past 6 months of the cooperation between St. Louis County and St. Louis City on areas of mutual interest, on policing hotspots, on cross-border crime. There's been a lot of effort to work together, and I think that will continue with Chief Gregory.
Also tomorrow, I know you have a point in time unhoused count that's going to take place. Could you walk us through that process, how it works, and some of the trends that you've been seeing in the county when it comes to our unhoused population?
The question about homelessness in St. Louis County, homelessness is a challenge for our region. And I spoke to our Director of Human Services just 2 days ago. Mayor of the City of St. Louis, Mayor Jones, called me. And we're talking about how we can work together in our department and county government that interfaces with our homeless population, tries to find them housing and tries to find them services, is coordinating their efforts with their counterparts in the city of St. Louis. Homelessness has been a challenge in St. Louis County for decades. We're especially concerned about it when the temperature drops like it is. We're focusing our resources from the CARES funds on rental assistance to do everything we can to avoid unhoused and unhoused populations, to help them stay in their homes. And we're working as hard as we can to get people a place to stay, especially during these cold months.
Do you know how the homeless count works?
The homeless count, I'm not familiar with the counting process. I'll leave that I'll leave that to the folks in the department, and they'll work with their city counterparts. But there's a process that they use, and I'll trust them to work together to address the problem.
Just to a question about contracting process and minority participation program. There's a bill that council is considering that would change the program requirements to allow the county discretion to adjust them by contract. Is that something that you've seen? What are your thoughts on that idea?
Yeah, so we passed a minority participation bill a couple of years ago. We knew we'd have to tweak it. We have a robust department. It's taken us really a couple of years to build that in St. Louis County. It was relatively new. When I became county executive, we were a little bit behind the rest of the region in minority participation. We're catching up. We're building that program, and we're going to have a good program that has the confidence of all contractors in the community, and we're going to make sure it's fair. We have a business advisory council that I appoint that's approved by the council, that the county council that's supposed to and is providing some guidance. If the county council wants to tweak that language, it has to be supported by the disparity study. All minority participation language, all minority contracting language ordinances has to be supported by a disparity study. And if it isn't, then it's not fair and it won't withstand legal scrutiny. I want the program to work. I want it to be fair. I want it to have the confidence of all contractors in the community. And if the council wants to tweak it a little bit, we'll talk about that. But we have to be very careful about making those changes because it is a delicate balance. And we need to make sure that the rules are understandable and clear to everyone. But we'll continue to talk about that.
The county and city are working on a disparity study now.
Right.
Correct?
That's right, and that's a good point. I'm glad you brought that up. The question is about the disparity study that is in progress. The county and the city are currently reviewing RFPs, proposals to perform that disparity study. That disparity study will take over a year, but it'll be a joint process by St. Louis City and St. Louis County. That study will set goals for minority participation in county contracting, and then we'll set up a legal process, a procurement process to purchase services that addresses those goals when we purchase goods and services and get construction work done in St. Louis County.
And the council, as I understood it, could be making a final vote on this bill next week, and that would shift the requirements from being a set percentage rate to being based on a per contract basis. Is there any concern that that would remove some of the measures put in place to try to ensure more participation?
So the big question there is the council considering changes to the minority contracting language and concerns that we have. I think there's a lot of proposals in front of the council, and it's a very, very fluid conversation right now. I don't think the council's decided which direction they're going to go. They're in the process of listening to stakeholders, and that process could take some time. But I would be concerned about something that's proposed by the council that wasn't fair, that wasn't based on a disparity study, and didn't have broad support among contractors in the community, all contractors. So I'll be watching what they're doing. The council has a pretty good relationship with our minority participation department in St. Louis County, and I think we're all working together on the same goal here. Any other questions? Okay, thank you.